Good afternoon, everyone. My name is Aisling Gillen. I'm a Senior Research Fellow with the UNESCO Child and Family Research Centre at the University of Galway. You're very welcome to the second of our three-part webinar series on complexity theory for better child protection and welfare and public services. My practice and leadership background is in public service delivery systems, and I've come to the UNESCO Child and Family Research Centre at the University of Galway to create a programme of research and action focused on complexity theory. Our guiding philosophy for the complexity theory work programme is that since complexity is a feature of modern public service provision, rather than seek to simplify and rather than fear it, we need to harness it for better outcomes for citizens. Specifically, the aim of our webinar series is to create insights into how complexity theory frameworks and approaches can help practitioners, managers, leaders, and academics to better understand and engage with complexity theory at practice, service, and system levels. We are working on understanding the systemic and dynamic characteristics of complexity and how adopting a complexity focus can contribute to better risk management, judgments, decision-making, and evaluation in complex public sector practice, services, and systems. And in this second webinar, we are focused on complexity theory and public services. And today we're examining how complexity theory can guide public management practice. Our speaker today is Dr. Mary Lee Rhodes. You're very welcome, Dr. Rhodes. Mary Lee Rhodes is Associate Professor of Public Management and Co-Director of the Centre for Social Innovation at Trinity College Dublin. Her research is focused on complex public service systems, and she teaches management, social innovation, and systems transformation in Trinity Business School. In addition, she regularly consults with public and non-profit organisations in relation to housing, human rights, sustainability, and social innovation. She has served on a number of government and non-profit boards and committees, more recently as chair of the Interim Regulatory Committee for Approved Housing Bodies. She is a member of the Business and Human Rights Implementation Group in Ireland and a member of the Advisory Group for the National Bioeconomy Forum in Ireland. Our respondent today is Dr. Fergal Lynch. You're very welcome, Fergal. Fergal is Senior Lead in Government and Public Policy Engagement with the University of Galway. He works with the university to help foster closer links between policy practitioners and academics in the development, implementation, and evaluation of public policy. His work areas within the university include supporting research, teaching, and civic engagement on policy development, analysis of public policy issues with a focus on lessons for the future, and lecturing on selected postgraduate courses. He is also an external advisor to the OECD project on strengthening public policy and strategic foresight in the Irish Public Service, in conjunction with the Department of the Taoiseach and the Department of Public Expenditure. Dr. Lynch was previously Secretary General of the Department of Children, Equality, Disability, Integration and Youth up to 2022, and Deputy Secretary General of the Department of Health from 2012 to 2015. So today, Dr. Rhodes will speak for approximately 25 minutes, followed by Dr. Fergal Lynch from the University of Galway. Fergal will reflect on what complexity theory offers and can offer to public service work, and how it assists us to navigate thorny problems in public management. We will have some opportunity for questions and answers at the end. I'm now going to pass you over to Professor John Canavan, who is the Associate Director of the UNESCO Child and Family Research Centre here at the University of Galway. And John will say a few words of welcome and will act as moderator for today's event. Thank you.
Thanks, Aisling, and you're welcome, everybody. It's great to be here again for our second webinar. And again, for those of you who don't know me, I'm the director of the centre here, but also personal professor in political science and sociology at the University of Galway. My job is really to filter questions and comments so that we have something to bring into our Q&A session at the end. So please use the chat function. We're going to use the chat function rather than the Q&A on Zoom. So put your questions and comments into the chat and maybe send them to everyone. And again, just to say, you know, really this opportunity, as Aisling says, is about maybe bringing some new ideas and different ways of approaching the challenges people face in the day-to-day of their work. So it is of interest to us to see if the ideas that are being talked about today resonate with you and are meaningful. And again, help you, or maybe that you're not so sure about them. Any and all comments and questions are welcome. So please do use the chat function for that purpose. So I'm just going to hand back to Aisling to formally introduce Mary Lee.
So welcome now to Professor Mary Lee Rhodes, and delighted to hear your presentation. Over to you.
Thanks very much, Aisling and John, for this kind invitation to allow me to share some of these ideas with this audience. And also thank you to Fergal, who willingly read the documents, and I look forward to hearing his thoughts as well. I might share my screen to get us started, if that's okay. So I'm hoping that everyone can see that. The slide saying complexity theory in public services. Is that good? We're getting nods. So I'll just crack on right away and hopefully use my 25 minutes wisely. What I'm going to talk about is kind of my journey to adopting complexity as a way of understanding public services and a way of analyzing them for the purpose of improving them. And then talk about a framework that published a while ago and how we've used it and how that framework helped us generate insights around specific examples of public services and change efforts in Ireland. And then maybe come back to another article that we've published recently specifically around performance outcomes, which I understand was of some interest in the first seminar. And then hopefully we'll pass it on to Fergal and have a good discussion around where these may or may not add value. So if I can just start around coming around to complexity theory, it's been a long journey from new public management, which is a set of reforms that began in the 80s in the UK and in the United States, also in Australia and New Zealand. And essentially this introduced sort of management theory into the public sector. And you can see there on the left-hand side, an analysis by Pollitt and Buchart, very well-known analysis of the different ways that these reforms were adopted across the world, and kind of a range of choices made in governments about how they would introduce these management practices, which were characterized as being essentially reforms around managing better within organizations, the decentralization of public sector, and then indeed privatization and incorporation of other actors. And so you see there that this resulted in a significant expanded role of the private sector and nonprofit sector. So you had many different actors coming in into this area of public management, new forms of democratic participation, so sharing governance and indeed delivery decisions and design decisions. And the last bit there around the quote from Weber in 2005, where academics were largely in some ways not caught up with what was happening in the reform of the public sector. And when I started my work in Ireland in the late 90s, the kind of academic theories around public management and the practice of public management had become quite disconnected. And so sort of searching for a way to figure out what was going on and how theory could adapt to practice as opposed to practice adapting to theory. And of course, in the meantime, while the public sector was having its own engagement with reform and others were engaging with the academic side, well, the world was moving on, and we were seeing technological change speeding up, particularly obviously computers, the internet, artificial intelligence, et cetera, creating opportunities and threats for the public sector and indeed public services. Wicked problems, we could name hundreds of them, but ones that sort of come out regularly is as challenges to the public sector around family breakdown, homelessness, obesity, climate change, etc., continually being there and not responding to efforts to solve them. Seeing more and more unanticipated outcomes from interventions. A good example of one in Ireland, in the area that I'm particularly familiar with in housing, were the surrender grants of the 1980s for social housing, which instead of improving the social housing areas, actually resulted in much more challenging areas of the people who were left behind. So tenants who were able to take up the surrender grants moved on to other housing, leaving those behind who were particularly vulnerable or particularly challenged. And so these unanticipated outcomes kept being something that we found difficult to say, how could we explain the things that we tried to do and then something else happened that we weren't ready for. And while all of these challenges were being presented, we were also finding that there were theories within physics, honestly, and biology that were evolving around how to predict the behavior of systems with multiple actors, with different characteristics, interacting with each other and the environment and changing over time, that started to provide insights, particularly from the Santa Fe Institute in the United States, that looked like they were going to provide insights into human systems. And these theories of complex systems, chaotic systems, adaptive systems, all started to come to the fore around human systems to say this might help us figure out what's going on. And so kind of the last coming around to complexity was, for me, was finding that these complex systems theories and frameworks and models that were being developed out of biology and physics, chemistry, were actually incorporating multiple actors, different characteristics and objectives interacting with each other, which looked a bit like what was going on in public sector reform and change. They also accounted for the potential for actors to adapt to changes, not only in their environment, which was quite a straightforward thing. If something gets hotter, the animals can change their behavior to survive in it better, or plants, but also to each other. And this was a really important feature of complex systems for human systems, that people adapt to the behavior of each other. An advantage of complexity theory was that it provided, in the frameworks and models that were being developed, recognizable patterns that if a system was configured like the model that was being developed or like the model that was being proposed, then certain behaviors could be anticipated. Not that they always occurred, but they could be anticipated, and they would then subsequently affect what would happen in the next period. And things like emergence and path dependency, which I'll talk a little bit about as we go and give some examples. But these patterns helped understand why we were getting unanticipated outcomes, why we were getting the kinds of non-response to our interventions in the systems we were trying to change. And then lastly, which I've just referred to, is that the modeling and analytic frameworks that were coming out of complex theory areas were useful and could help us understand what was going on in the series in public services. So that's why I decided I would try and use complexity science to help me understand specific examples of public services in Ireland. And my first efforts were in the housing area, and I had two parallel pieces of work. One was a longer term work in the housing system in general, and the second one was work that was funded by the HEA around very specific cases in urban development and information systems projects in healthcare, to try to understand well-defined areas of complex systems delivery and change, and to see if there were patterns that we could identify that would help us understand them and intervene. And this is the framework that came out of that work, which we called, not very creatively, the 6+4 analytic framework. And the 6 refers to the 6 elements that you would look for in a system, which would be the boundary of the system itself, the environment made up of rules and factors, which were features 2 and 3, which also could be perceived within the system, the agents that were part of the system, the processes that they engaged with, and then finally the outcomes that resulted from that system. And if you used that basic framework of the features of the system, you would be able to hopefully understand a bit what's going on. And then the 4 were features of the dynamics of the system. What happened in the system that could be related to complex adaptive systems theory. And we'll talk about the 4 things there, but they have helped me and my fellow researchers describe what a system has, what the system has looked like, who is involved in the system, and what has happened in ways that we otherwise might not have been able to explain and then to act creatively, but also effectively in these complex systems. So I might do just a quick description of those in the next slide around insights that this model helped us pull out of the 6 cases in urban development and regeneration and in healthcare. So the first one around the boundaries of the system, we found in the examples that defining where you drew the boundary, who was involved, and what processes would be part of your systems analysis and systems change was non-trivial and had major implications around what solutions you could propose and what things you might anticipate. And so examples in this one would be in the healthcare systems that we were working on, the different roles of people. So the boundaries between nurses and doctors, or managers, or patients, or indeed in these particular cases, the information technology professionals, who each of them saw things in different ways, but also they, including them or not in the boundary of the system that you would look at, made a significant difference to what you ended up deciding was the issue you would intervene in, or indeed what was wrong or what was good in the system. The other issue it raised would be legitimacy for your ongoing engagement with people. And path dependency has to do with systems that have a set of initial conditions that frame what is possible for the system to become or to do over time. And what we saw in our system there, and this is in the an example there in urban regeneration, was early experience with urban redevelopment. This would have been one of our cases in Northern Ireland, resulted in one community, the community of whether it was Unionists or the Protestants or the Catholics, in where they lived in a neighborhood. It resulted in one community leaving in large numbers. And this had happened 20 years ago. And so when they returned to try to regenerate that area, there was significant mistrust about what the actual goal was going to be of trying to regenerate, essentially rebuild housing and improve the housing conditions. And so creating a shared vision together of what regeneration might be was very much dependent on what had happened 20 years ago and how people perceived the aims and indeed the goals of the different actors. The third insight around what we saw in systems dynamics was that when you introduced different actors into public sector led projects, so whether it was the private sector or communities or the NGOs, we saw that the private sector involvement tended to be more likely to create a significant change in the trajectory of the system, or a systems bifurcation. So the case in the healthcare was HealthLink in Ireland, where it was quite, there wasn't a lot of exchange of information between actors. In this case, it was GPs and hospitals, and technology had started to change. And there was an example of very, very old style modems being introduced with a few GPs and the Mater hospital. And then the introduction of a private initiative to use internet solutions in order to create communication between GPs and hospitals resulted in a very large increase in the participants in that network. And then lastly, the presence of the complex adaptive systems, dynamics that I mentioned, path dependency, bifurcation, adaptation, etc. Those required the managers of any of these projects to be quite adept in to watch what was going on, to pay attention on a regular basis, not just to doing the tasks that they had been assigned or that they were accountable for, but what the actual results were, who was actually participating, and whether or not the environment had changed in such a way as to make the previously agreed goals and objectives out of date and needed to be changed. And those kind of came out of these 4 examples, and the book that we wrote in 2011 actually describes those in some detail. In terms of subsequent work, so while the first work on these cases of urban regeneration and IT development in healthcare focused on all of the pieces of the system and what kinds of insights could we gain from overall, there's subsequent work that focused in on specifically the outcomes, and you can see that circled there in the upper right-hand corner of our model, saying what do we know about the definition and measurement and management of outcomes? And this became increasingly, I'm going to call it, challenging and stressful in the public sector as multiple agents were introduced into any sort of project where the accountability couldn't easily be allocated or held by individual organizations or managers. And yet there was an increasing focus due to the new public management reforms on outcomes. So instead of being held accountable for managing your budgets or managing the tasks, we were being held accountable for the results of not only our own efforts, but efforts around the various stakeholders who might be involved in a project. And this became, a bit controversial and challenging. And the article that we just published with colleagues in the UK, saying, well, how can you understand the management of or performance outcome management if you are engaged in a complex system? And the article didn't give sort of the answer, but rather we proposed ways of thinking about outcomes and ways of thinking about the complexity of outcomes, such that you could hopefully avoid some of the worst results of trying to hold people and systems responsible for outcomes that they can't be held accountable for. And so you see there that this is something that, first of all, making sure you observe and acknowledge that controlling outcomes in complex systems is a bit of an exercise in frustration, given that one of the definitions of complex systems is that they are not predictable. And so trying to control outcomes and hold individual actors or even groups of actors responsible for outcomes is something that can lead to quite high levels of frustration and failure. The other insight that we get from complexity is that heterogeneous agents and participants mean that understanding or evaluating an outcome can be very different depending on whose perspective you're evaluating that outcome from. And indeed, the outcome could be considered to be, or the goal could be quite different for different individuals. So if you're saying, what is decent housing? Well, it depends maybe where you stand or indeed where you live. And so standardizing outcomes, which is something that historically has always been almost a fundamental piece of public sector management, that people are entitled to a standardized outcome or an equal outcome. This can be very, very challenging when you have heterogeneous agents with different expectations and capabilities to participate in these complex systems. And then lastly, the fact that outcomes will vary over time as the world changes, technologies are introduced, that we see that an intervention to try and solve a problem of availability of social housing actually results in worsening of the housing conditions or the living conditions of certain citizens. As we realize the impact of our actions, it is necessary to go back and reevaluate whether or not the outcomes we thought we were going for are the ones that we should continue to pursue. And so it doesn't seem like an answer, but more of a better awareness of what working in complex systems feels like and looks like. And I just will say the last sort of set of insights, so we were talking really about practitioners there in the last two slides, but the last set of insights that we would bring to people in the public sector are those for policymakers and leaders trying to set strategy. And this is a list from a couple of articles. We brought them together. One is on leadership in complex systems. That's the Murphy et al. Article. And the other one are a couple of, well, one's a chapter and one is a journal article on what does complexity in the public sector look like now. And this list comes largely from the 2021 chapter from Elizabeth and ourselves on public management and complexity, saying that boundary critique and people who can span, or entities that can span boundaries, are critical things to be aware of, that the boundaries matter, and then you may need to find ways of moving between boundaries in order to unlock the potential of complex systems. I'm sure people are familiar with the concept of unknown unknowns, which is a fairly unwieldy phrase, but the fact that we know there are certain things that we do know and we know work or don't work. There's things we believe we don't know and that we need to find out. And then there's the things that we don't even know that we don't know. And those things need to be constantly paid attention to in complex systems, because they will jump up and bite you if you didn't realize that they could. And confirmation bias is a bit similar to this. We find this is when we believe that we've come to a solution and we think this is the right thing to do, we actually, in evaluating it, tend to see that our expectations are confirmed. And the way you sort of deal with that is you make sure you get people to question your assumptions about what is occurring and whether the outcomes are successful or not. Nudging and new actor introduction, that's a way of shaking up the system a bit, but as I talked about, bringing in the private sector can have a bifurcation effect, can have significant changes, not always, but it can do that. We've already talked about the real-time monitoring of outcomes, and the behavior of actors will change over time, and making sure that you're paying attention to what's changing over time as you evolve and as the system evolves. The collective decision-making and shared accountability, there's a lovely example from my New Zealand colleagues around providing a very high-level outcome goal to various participants in this across the public sector in New Zealand. And they had one example around vaccinations and childhood vaccinations, where the goal was set to increase the rate of take-up of childhood vaccinations, but it was given to a range of actors. So it wasn't just the Department of Health, it was also Family Care, it was also Department of Justice, it was a number of actors, GPs, etc., who together were given the collective responsibility and shared accountability to achieve this, but without any instructions about how to do it. And so aiming for collective responsibility to a shared objective seems to be some way of dealing with some of the complexities of these systems. Attractors and performance peaks have to do with another framework, which I haven't even described here, which is performance landscapes and systems getting stuck in one place because they are attracted, that the various interrelationships between actors leave them in one place, and unsticking them usually means that the performance of that system will decline. And that's something to be prepared for if you're going to make a major change. And then last but not least, and I've just got a note from Aisling, 1 minute, is that practices in complex systems, the article that we published there, tend to be having to move between sort of administrative leadership, which is very directing and efficient, making sure that you're efficiently allocating resources and plans, and adaptive leadership, which is changing things. And that complex leadership is a series of behaviors that shift between those two types of leadership. And with that, I will say that's probably enough for today and a while. Thanks very much.
Thank you very much, Professor Mary Lee Rhodes, for a very interesting and really well explained around very complex kind of material. So thank you very much for that. I'd like to invite Dr. Fergal Lynch now to provide a response to that. So over to you, Fergal.
Thanks very much indeed, Aisling, and thanks very much to Mary Lee for what I thought was a really stimulating and valuable presentation. I think it's highly relevant to the public service and its work, both in developing policy and on practice. Look, there's so many different aspects I'd love to comment on, but I will confine myself to my slot of about 10 minutes. So just a bit of context for starters. I mean, from my perspective as a former Secretary General of a government department, I would observe that the public service, and particularly policy practitioners, those close to government, they're understandably pretty cautious. They're fairly conservative and somewhat risk averse. Now, this isn't out of laziness, and I'm not criticizing people in this context at all, but it's not out of laziness or a lack of interest, or indeed even a quest for an easy life. It's rather from probably a sober assessment of their operating environment. And that's why I think Mary Lee's work is so interesting, because one of the most pressing aspects of that environment is the political and public interface and the expectation of what is expected of officials. So the actions of officials, and of course elected government, will come under scrutiny, quite rightly. They face financial imperatives, performance pressures, multiple competing demands, and they all combine to challenge even the most resilient and determined of ministers and of officials. There is quite a concern about failure, about perception of failure, or a labeling of failure, which has real implications for them. In particular, I think officials don't want their performance or their action or inaction to reflect poorly on their minister or to create political embarrassment. And this results often in efforts to maximize control, encourage predictability, reassurance and certainty, some of the things that Mary Lee was talking about there. Now, of course, no senior official is likely to be naive enough to expect that all of these things will come into force nicely and neatly, but they look for as much predictability and reassurance as they can realistically achieve. I suppose it's partly a form of self-protection and of trying to control their environment. There's also the fact that policy officials in Ireland tend not to be lauded for experimentation or innovation unless it goes well. Now, to give some balance, obviously there are plenty of welcome exceptions, particularly during the COVID emergency, when the public system responded to produce quite extraordinary results in one of the most unpredictable and dynamically unstable environments imaginable. On a smaller scale, there are plenty of individual examples of innovation and experimentation in the public service, and I think these should be acknowledged. Small, simple one that I was involved in to a certain extent was the bail supervision scheme for young offenders, which was an inexpensive initiative that reduced the need to detain young people. It offered them a potential way out of serious crime and was considerably cheaper than full-time detention. So just to emphasize, there are positive examples of innovation too. But there will often be a focus on trying to control the environment. And this is where I'm going to come back to Mary Lee's points shortly, but minimizing the negatives, trying to stay out of the public eye as much as possible, trying to avoid negative coverage. So all of this makes the sort of linear, predictable policy development and implementation much more attractive if it's possible. Some fairly rationalistic approaches are possible in relatively non-contentious areas where there is good cooperation between policy actors, where there are agreed common goals, and a shared sense of what the best thing is to do. But as complexity theory suggests, the reality is usually different. And in the language of complexity theory, we face uncertainty, unpredictability with multiple levels of interaction, and impacts that are not always predictable on each other. So I think there is also an attraction within the public system towards the more traditional disjointed incrementalism or muddling through of Charles Lindblom, which again, Mary Lee's reading material would have discussed. This is seen as attractive because it involves small steps away from the current problem. And if it works, you can do more of it. If it doesn't work, you can adjust path in another small step without too much sudden or potentially disruptive change. And you can agree with other actors on simple next steps, even if you can't agree on the ultimate endpoint. All of that sounds nice and attractive in one sense if we lived in a simple world, but the limitations are obvious, especially the way in which incrementalism would move us a little away from a current problem rather than necessarily towards a solution. I think we need the notion of complex incrementalism that Mary Lee's work deals with. And this emphasizes the vision as a vital center point and incorporates the dynamics of complexity theory. So that's some of the context. And maybe now reflecting on what Mary Lee has said, for me, I'm going to offer you just a number of points which I think are of particular concern in the context and interest in the context of public service development and practice. The first one that I'd like to put into the mix is what I call embracing the chaos. And that's not a flippant or a devil-may-care sort of suggestion. But what it does do is, I think public servants need to recognize the multiple actors with many agendas and seek to factor them into their work from the very beginning. I think we need to see this as an opportunity and a welcome means of strengthening policy responses rather than trying to control them or to close them down. So embracing the chaos in a positive sort of way, I think makes a lot of sense, even though maybe our sense as public servants, particularly where we're affected by the political realities, would be to be much more careful. I think we need, secondly, some reflection, a sense of confidence and a greater willingness to make mistakes and to learn from those mistakes. Experimentation and testing can be something that's positive, not just a cautious one-off pilot scheme that doesn't get repeated. But if you're doing these tests and this experimentation, it's then really important, I think, to communicate what you're doing as public officials. And that communication is really key to this. You can take the opportunities then to explain in order to build on the confidence. And I think in this context, complex adaptive systems that Mary Lee talks about provide us with the chance to learn and adjust from the experience. It does, for me, raise some important questions about corporate knowledge and how to harness it and protect it, especially in times of challenge to recruitment and retention of staff. And we have such a difficulty in that area that while we build up corporate knowledge and corporate experience over time, the challenge is retaining that experience as people tend to move elsewhere, whether they retire, move to other jobs through mobility schemes and so on. I think then the debate underlines the value also of closer collaboration between researchers and policymakers, something that I have a particular interest in. And as Mary Lee notes, complexity theory can be a bridge between academics and policy practitioners. It raises another issue of effective training and education in the whole policy space, including making sure that public servants understand and are trained about the principles of complexity theory as we develop, as well as training academics in that regard. Other thoughts that I have in this area, I think we need much tighter linkages between government departments, agencies, and other stakeholders when considering our options and when considering implications and possible and responses. We've got to lose those. Area that I was involved in Department of Children was the development of the strategy First Five, which entailed a whole of government approach to the lives of babies and young children. Interestingly, some departments wanted to keep their own good initiatives for themselves, for their own minister to announce, I suppose separate good news for them to announce, which obviously went entirely against the process and hope of a strategy in First Five that would bring all these things together. I think related to this, we must link our policy design and development with implementation. And again, it's another element that complexity theory rightly deals with considerably. I think national or international development of something followed by local implementation is almost bound to fail. I've seen a number of poor examples where policy solutions were developed centrally and then passed on to others for local implementation. Those at the coalface then either didn't understand what was intended or didn't agree with it, or had valid points to make about why it couldn't be done in the way it was proposed. By welcome contrast, some of our best examples of policy effectiveness have been where those directly affected by the policy proposals, including those tasked with implementing it, have been closely involved in all stages. And staying again in the children's area, I'm thinking of the access and inclusion model for participation of children with a disability in the preschool ECHE scheme, where we closely involved everybody involved in the system to create or co-create a solution that I think is working pretty well. Look, all of this means that I think we need to operate at multiple levels of scale simultaneously, as referenced in complexity theory. It involves engaging with people, many different stakeholders, sometimes with very different perspectives and agendas. It means at a practical level, getting the Department of Public Expenditure involved at the early formation stage, not waiting until the end to come to them for money. And above all, being aware of so many different moving parts. I think complexity theory should also prompt us to be more open to alternative solutions and problem solving. We need the resilience. We need less defensiveness and caution in our policy making while not being unrealistic about it. We need to be prepared to explore, even if, as is so often the case, we're pressed for time and subject to so many different competing priorities. Pragmatism, based on good evidence and analysis, I think can bear fruit. We can use the wide-angle lens of complexity theory rather than the narrow lens of immediate pressures. And I'd strongly endorse Mary Lee's point about the need for managers to engage in real-time analysis and to remain flexible, to adapt and to change. We often target. And a good example I'm thinking of is an integration policy where in the Department of Children, Equality, Integration and Youth, we started with one approach to trying to end direct provision. Then the invasion of Ukraine changed everything in terms of our policy responses to a much wider group seeking out protection. Finally, I was struck by the point made in one of Mary Lee's papers about navigating change rather than simply trying to manage it, because sometimes management and control in this sort of context can be highly problematic, may even be counterproductive. So the flexible navigation that Mary Lee described brings me back to where I started my comments on embracing the chaos, being prepared and able to adjust as both the expected and the unexpected arise. And finally, I think it's important to acknowledge there are plenty good examples of the approach that I'm advocating in a number of policy areas. Maybe I've been a bit negative in the setting the context stage, but it's a negativity born from an understanding of the operating environment in which we are. So really what I'm arguing in agreement with Mary Lee is that complexity theory can be harnessed further, and when it's properly used, it has a significant amount to offer to us in our public policy practice and our development. So look, thank you very much indeed for the opportunity to contribute, and I look forward now to the discussion that we're about to have.
Okay, thanks very much, Dr. Farrell-Lynch, for those very insightful comments. And just I think between yourself and Mary Lee, you've certainly provoked a huge amount of thinking and hopefully a lot of discussion. So I'm going to pass you over to John, who's going to work through the Q&A.
Thanks, Aisling. I'm guessing that some of the participants are possibly overwhelmed by the richness of the material. So we're not getting a huge number of questions, but I certainly have plenty myself. And I just want to say before I forget, Fergal, I don't know where that came from, but the wide angle lens of complexity versus the narrow lens of immediacy, if that's your own or somebody else, I will be using it. Thank you very much. It's a very, very helpful, I think, metaphor. I wouldn't mind going back to Mary Lee on outcomes, because I suppose that's one of the things that actually is what really pushes, I suppose, practitioners. It's something that ministers want. It really is difficult, and I suppose I felt that in what was presented, it moved it away. It's hard to say, well, how do you deal with that then? And I know there's people on the webinar coming from the CIPSI background, and they have to deal with the CIPSI, the Children and Youth Services committees. They have to deal with this issue as well in terms of, well, whose outcome is this, and who's accountable. I think it was very interesting what you said about the New Zealand context, which is set the high level goal and actually allow the complex system to deliver on that. I probably feel, well, what if they all start doing the same thing and start wasting resources and so on? So there's the kind of questions in my head. Could you maybe talk a little bit more about maybe the case study material and also the conceptual side on the outcomes?
Sure. So what I would say is the main contribution thus far from complex systems theory to the measurement and management of outcomes is, beware what you wish for. And that is, I think, at the core of it, what complexity theory brings is it isn't something that says, oh, here's a different way to measure and manage outcomes. It says you really need to be very careful about setting these things very, very, very precisely and tightly, because the system is potentially going to react in a way that you don't expect, and therefore can get outcomes that you really didn't want. And things like obesity has been studied, and I'm going to come back to the question, which is the case in New Zealand, which I only have very passing. It wasn't a case I worked on, so I'm really using the report or the reporting of someone else, Ted Benzel. So in that case, this is a reform initiative in New Zealand across a number of public services, where they essentially went away from telling individual departments and individual agencies that they were responsible for the following thing, and setting large goals. So it was across a number of different areas: education, healthcare, I think they had some transport things, energy, etc. And having agreed in some ways at a very high level what they'd like to see in the next 3 to 5 years, then they would bring in any number of department representatives and agencies and say, okay, we're going to set you off with this goal in mind. And the thing that the network manager does, and this is something that I thought of as Fergal was speaking, what is the role of the public sector in a complex system? That there was an entity charged with assessing separately the achievement of this overall goal. And each individual organization is in many ways negotiated with each other about how they would contribute to achieving that goal. And I think that's where we see the subsetting of objectives will occur, but they're set by the entities themselves. And they can change them, because they're not, those ones are being measured to the extent they're helping an individual agency or an individual actor do its piece of the system, but they're not the ones that are being summarily reported or shared with all of the system about, are we getting closer or further away from the objective we have set. And that would be the gist of what was found in these cases, is that yes, there were objectives set as sub-objectives for individuals and for individual agencies, but that wasn't the thing that in some ways the network or the governance area measured. And so they were allowed to float, to make them, to not make them, but collectively they were held accountable is probably a little bit strong a word, but they collectively held each other accountable for this larger goal that was then, reported back on by a third party, which I'm not sure if they had explicit third parties in every single system, but that was the basic approach to doing this.
Perfect. Thank you, Mary. That's really, really helpful. A question that went into the Q&A, and I'm not sure, what is a good way of managing the defended approach that is characterized by fear of failure or fear of making senior managers look bad? Maybe for Fergal, how do you actually manage that? How do you deal with that? And maybe how do you push them and maybe nudge them towards?
It's a very good question, and it's one that Indeed, towards a solution. Yes, and I was conscious when I was making those points that they may sound a little bit overly defensive, and genuinely they're not meant to be, and neither are they meant to be in any way critical of senior public officials who are managing in an extremely difficult environment. But there is this sense of fear of failure and concerns about embarrassing ministers and so on. For me, I think the critical way of managing all of this is to try and build up a relationship of trust with everybody that you're dealing with. The reason people fear failure is because they believe that they will be criticized for it and perceived as not having done their job and not being competent to be where they are. If you can develop relationships with the key stakeholders based on communication, which says, here's the issue, here's what we're trying to do about it, here are the different components of it. We're not going to claim to be able to do everything, but here is what we're trying to achieve, and here's how we're going to do it. That brings you back to the element of trust and building trust that I was talking about earlier. If you can explain, communicate, and be as transparent and upfront as possible, I think it is a good way of managing it. And for me, it's as important to be clear about the things that you can't or won't be able to do as the things that you can. And also, and this is a really challenging thing for our political environment, to be able to say, look, we tried something and we expected that it would work in a particular way, but it didn't work. And maybe it didn't work at all, or it worked only to a partial extent. So an ability to acknowledge failure or part of failure and to say, look, we tried something, now we're going to do something else. Now, unfortunately, that's a challenging thing for the Irish environment and maybe for many others as well. But I think the communication, the working with stakeholders, and the building of trust are probably the key elements.
Yeah, thanks, Fergal. It's quite interesting. We talked about it many years ago. I remember talking to people about, well, we tend not to do conferences about what didn't work, you know. And
Yes.
I mean, it's probably a cliche almost at this stage to say that, but it would be really interesting to take, 2 days out to consider policy failures and what were the factors maybe that led to that and so on. So maybe a question for Mary, I suppose, well, from a policy development point of view rather than a policy implementation point of view, would you some insights on complexity theory at that point in the process? Because Fergal did refer to it, I think, in his contribution around the inclusion of, a broader range of stakeholders and so on and so forth. Would there be some other insights that you'd have, Mary, on that point? You're muted, Mary, at the moment.
There we go. Got it. Sorry about that. Technical difficulties. I'd like to just comment a little bit on this, the fear of failure, as well as part of the solution, I think, or part of the way of addressing it. I mean, there is a cultural aspect. Is when we talk about changing organizational culture, it is a long process. So that if this is something that people think would help policy and practice in the public sector, it needs to start and be supported for a significant period of time. People need to not only be taught how to do this, but believe that they won't, be held up for public ridicule if they try something and it doesn't work. The second thing I'd like to say on this piece is there's a well-crafted approach called policy experiments, which there's methodologies for this, and you can set the whole thing up as an experiment with boundaries. And as John was, I think, very clear, saying you have to explain what you're doing, but it is something that is done all the time to say, well, we're going to try something out. And there's the most recent example that I was interested by was the one in Finland around basic income, and it's well known. So I mean, I think if we can sort of introduce this idea that failure, as long as failure was a learning experience, that was the risks were as managed as they could be, this is part of significant change, and we know that well. I think the other thing that I would say is, and one last insight on how do we incorporate what we see as complex behavior or complex features of systems is I was looking at the housing system. So the other piece of work that was a long-term look at the housing system in Ireland and what the different roles of the different actors were. And so the public, we'll talk the local authority largely in here, local authorities, NGOs, private sectors, largely had very similar roles, except one. And that was information sharing across different actors. And the public sector was absolutely vital for sharing information. The private sector didn't do it just for competitive reasons, largely. The NGOs were in less of a role and had less of a credible and less power, in fact. Their information maybe didn't matter as much to the system. But the information sharing role was absolutely vital in enabling any sort of activity, never mind a significant change to occur. And the public sector was the only actor with sufficient reach and credibility to be in a position to do that effectively.
Great. Thanks very much, Mary Lee. I'm just wondering, Aisling, we're probably heading for the time for a wrap up, I'd say. So maybe we might do that. What do you think?
Great. Folks, thank you very, very much. Thanks to all our participants, Professor Mary Lee Rhodes and Dr. Fergal Lynch and Professor John Canavan, and also thanks to Gillian Brown, who organised this webinar series and has done a lot of the work in constructing it and putting it together. I think the discussion, it feels like the start of a discussion. I came across Dr. Mary Lee Rhodes' research work through my research on complexity theory, and I certainly have found it very useful in terms of its explanatory support to trying to, use complexity theory more practically in public service and child protection and welfare systems. And I really do commend you on that, because I certainly think the transferability of this to actual practical work is certainly a huge area of our interest. And really the depth and range of Dr. Fergal Lynch's experience certainly in responding today is hugely valuable. And I think it really just calls for further discussion, really to kind of work through the transferability of this in practical terms to support practice, services and systems in this complex public sector and child protection and welfare work that we're engaged in. So really, thank you all very much. Thank John for, as usual, his wonderful way of connecting all of the comments together. We will have a third part of this webinar series taking place on the 18th of October. Gillian Brown will be circulating information on that further into the summer. And we will have Professor Eileen Munro from the London School of Economics with a huge range of experience in evaluation of complex child protection and welfare systems, who will be our main speaker on that day. So we'll welcome you back, hopefully in October, but we certainly would welcome any comments, any interest from anyone in relation to this work to really kind of build into the discourse and the conversation from today. So thank you all very much for your active participation, and we shall meet again.
Thank you.
Thank you. All the best. Bye. Thanks.
Bye.